All right, people, I'm going to give you another video on questions and rationales with answers from the same book that I did the previous two videos from. Again, this is not my content. These are not questions that I came up with. These are questions that came from a book that a friend gave me, and so this is all them. So here are the questions, and I'll give you the next video with the answers. Alright, so question number 1. There will be 10 questions. Question number 1. In a group therapy session, the group members began scapegoating one member. In efforts to help the group progress, the social worker should A. Allow the group to continue, B. Support the individual who is the object of the scapegoating, C. Bring it to the group's attention, or D. Direct the group to stop. Question number 2. When identifying a culturally competent social worker, the most important factor is A. The social worker's ethnicity, B. The social worker's awareness of self, C. The social worker's thought and feelings about ethnicity, or D. The social worker's ability to communicate with individuals. Question number 3. A client in therapy who is usually reserved and doesn't speak very much during sessions has an outburst, gets angry, and starts expressing the details of his life as a child. According to a psychoanalytic social worker, the client is likely undergoing which process? A. Revelation, B. Catharsis, C. Cathexis, or D. Identification. Question number 4. A man is seeing a psychiatrist for alcohol abuse, is prescribed a drug called antabuse. The drug causes the individual to become physically sick whenever he consumes alcohol. After several episodes of sickness, the man stops drinking completely. This is an example of A. Negative reinforcement, B. Positive reinforcement, C. Punishment, or D. Conditioning. Question number 5. When a client is diagnosed with a mental illness along with an alcohol use disorder, the client is said to have A. Secondary diagnosis, B. Dual diagnosis, C. Split diagnosis, or D. Axis 2 diagnosis. Number 6. A child charged with shoplifting and truancy is assigned to a social worker in a juvenile detention center for treatment by his juvenile officer. The social worker's primary role is to A. Take a full social and family history, B. Investigate the charges surrounding the charges, C. Prepare a recommendation to the court regarding disposition, D. Explore with the child her feelings and involvement surrounding the alleged charges. Question number 7. A client has been seeing a social worker for several weeks. In this short time frame, the client has made significant progress and is at a critical stage of treatment. The client is beginning to uncover some difficult thoughts and feelings about her childhood. At the next visit, the client tells the social worker that she wants to discontinue treatment. The social worker does not think this is a good idea because she is so close to meeting treatment goals. The best course of action for the social worker is to A. Begin termination with the client, B. Explore with the client her reasons for wanting to discontinue, C. Explain to the client the significant progress has been made and that it is natural for her to want to discontinue in light of difficult issues that are being addressed, D. Tell the client that you will reduce your fees if she agrees to continue. Question number 8. Which of the following would be considered a breach of the code of ethics? A. Accepting a bottle of wine from a client during the holiday season. B. Telling your husband about your client and her issues. C. Reducing your fee for a client who lost her job. Or D. Commenting on the physical appearance of the client. Question number 9. An individual who was sexually abused as a child will most likely exhibit which defense mechanism? A. Denial. B. Intellectualization. C. Anger. Or D. Displacement. And the 10th and final question. A child is referred to her social worker for suspected physical abuse. The social worker should look for all of the following signs except A. Bruises, welts, and burns on the child. B. Excessive accommodation of the child to please her parents. C. Poor hygiene. D. Hypervigilance. Alright, so those are your 10 questions. If you need to rewind and go back and listen to them again, gather your answers, and then click on this second video with the answers and the rationale. Hopefully this helps everyone. Please like and subscribe, and leave me comments in the comment box if you have any suggestions or requests for video topics.